If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joyful giving. If we try, we shall see. In this place we cannot feel the dread to stop existing and start living.
Have a great moment, everyone. Welcome once again to the Instructor's Compass. Our topic for this moment is the nurse educator introduced. Again, let me repeat the topic. The nurse educator introduced. Nursing and education had been considered at the opposite poles of professionalism. While teachers always wanted to talk, nurses would rather have a controlled and quiet environment. While teachers wanted verbal responses from students, nurses can see progress in the well-being of the patient and will rather force them not to talk if they cannot be comfortable. That is why, contextually, old people would rather have a notion that when you are a quiet person, you rather take up nursing, and when you are talky, then venture into teaching. Of course, these are all experiential and observable myths. Honestly, I decry this observation as really discriminating and at times unfair. For some nurses can talk, and some teachers would rather keep quiet. However, my greatest defense is by far my personal experience being a teacher and at the same time a nurse. So it is possible, and my experience would prove this myth wrong, as nurses can always be teachers and teachers can always be nurses, and interchangeably they can be successful. Now, beyond the traditional myth mentioned above, in the four corners of nursing, teaching and nursing are completely inseparable. You can never finish an 8-hour shift only doing nursing work and recording nursing documentation. Why? Because it is part of your job to really let the patients understand the purpose of care and the necessitated intervention that will help in their treatment. The information dissemination from nurse to patient is already a form of nurse teaching or nursing education. Thus, this is a proof that nurses cannot have any other detour but to be a good teacher also. Since then until now, nurses are always known to be professional generalists. What is the meaning of the term professional generalists? Well, this means that nursing is one of those professions that needs knowledge in other professions to be effective in work. Say for instance in a hospital, a nurse on duty at night may need to have general knowledge how to fix a cable TV and a cable box at the patient's room when the engineering department is expected to be closed during night times. Another instance may be that when it is 3 a.m. and a patient dies, a pastor is understood to be resting from home or the priest may be in deep sleep. Thus, nurses needs to know how to pray for committal or anointment so that they can fill in for the pastor in moments like this. Well, these are not the only instances. All medical procedures and even hospital routines, when not understood by the patient and the watchers, may need further explanations or reteaching from the nurse for clarity and simplicity. This is teaching at its most rigorous way. That is why nurses are also expected to be clinical educators, and that is the very reason why there is a semi-major course in college called health education, so that nurses, when they will be on actual duty in hospitals or wherever as long as they implement nursing care, will not be shocked with this function of teaching that is expected from them. By now, you already understand 80% of the time, the nurse is always teaching. So, 80% of nurse-patient relationship is always formal and at times informal teaching opportunities. That is why this Added expectation to a nurse must not be considered an added stress, but an extension of service that can touch hearts in the process of fulfilling the work.
Lastly, it should be known as a fact in healthcare that nurses are the most credible teachers in the clinical area and in the practice of healthcare, because this is the only profession that watches the patient and get involved with them for 24 hours. So they really know what is going on, and they can educate patient from actual observations and history details. Other medical professionals only come and go, they only meet their patients as needed, and for doctors only for rounds and procedures. That is why call medical professionals who only consult the chart and do not get educated by the nurses who are with the patient for the shift usually get only what is written, but eventually is blinded with what is not written on record. So I hope if you are a future nurse and you are taking the course health education, be thankful of the chance to have learning so that when you will be a great nurse someday, you can also be a loving teacher to persons in pain and discomfort who needs your presence. Once again, this is your instructor's compass, and this is Sir Noy Gonzaga, a registered nurse and a licensed professional teacher, bringing to you 10 bits of knowledge in our online advocacy program under the Academia Gonzaga and Jervin Eagle Viewpoints production. Until the next topic will be enlightened and opened, God bless everyone.
See, there